Okay. First off, thank you very much for your time. I know that it's precious. Can you just give me just tell me your name and your organization so I don't mispronounce anything?
Yeah, so my name is Dr. Mohammed Mustafa, and my organization is PANZMA, which stands for the Palestinian, Australian, and New Zealand Medical Association.
Fantastic. First off, where are you? Um,
I'm in Gaza City. I'm at the Baptist Hospital in Gaza City, which is technically the north, towards the north
okay.
of Gaza, past the
Okay.
checkpoint, north and south.
Have you been moving around because you were somewhere else yesterday, correct?
So we have been moving around a little bit prior to this, but obviously since the bombing started, we are not allowed to leave the hospital grounds. Just today, there was a foreign UN worker that was killed in Gaza.
Okay.
So it is very, very dangerous right now for all the aid workers here. Even with um, you know, coordinated with the Israeli military, there's still risks of you getting shot, killed, or missile or drone attack. So, yeah, we are. The bombs have been going non-stop since the bombing started. We're still getting casualties arriving every hour into the department. Luckily, it hasn't been at the same scale that it was on that particular night, but we're kind of worried that there's going to be another similar incident like that pretty soon.
Okay. So you said in coordination with the Israeli military, so IDF is on the ground where you are now, as well as the bombing?
I don't know if they're on the ground where I am exactly. I know they're in Gaza, but
Okay.
they're borders. I don't know if they're near where I am,
Okay.
but we just go along with what our coordination teams say. They're the ones that are in contact. We don't really have anything to do with it, but we have just been told that we're not to leave the hospital grounds. There is no safety outside the hospital grounds.
Okay. Tell me who you've been treating. What kind of injuries are you looking at? What are you dealing with right now?
I mean, we are, the injuries that we're dealing with range from crush injuries from buildings collapsing on people and them being stuck for maybe hours sometimes underneath the rubble. We're dealing with burns, people who have their face burnt, their bodies burnt from the fire, post-missile attacks. We also have blast injuries as well. And the blast injuries, we see that a lot with children. So when the children come in, they look like they have no penetrating injuries on them. They're not bleeding from anywhere, but they actually are dead. And the reason is because of the force of the bomb, it causes internal bleeding. So we get blast injuries. We also have shrapnel injuries and people with penetrating wounds. And obviously we have gunshot injuries as well. So we are dealing with a wide variety, and that's just the trauma side of things. Then we have the malnutrition, we have the skin infections, chest infections, because there's a lack of basic hygiene and sanitation. And obviously, with all the debris, a lot of people are getting chest infections, especially the young and old.
How's the supply chain right now? Are you guys getting supplies now? Or
There is no supply chain at the minute right now. We are essentially cut off from the rest of the world for the last 3 weeks. That's
3 weeks.
including medical supplies as well. We are very, very low of every kind of medical supply. We have no ventilators in the emergency department. We have very limited ventilators in the whole north of Gaza. And when we had the mass casualty event, we ran out of propofol in the department. We ran out of morphine. We barely had any ketamine left. That was the only thing that left that we had, but we pretty much ran out of everything else. And
So
yeah,
do
we
you
were
remain
doing.
out of, I'm sorry, do you remain out of anesthesia?
So we do have some anesthesia that because the borders had been open 3 weeks ago, so there is some anesthesia around. Unfortunately, that anesthesia is being used a lot in the surgical department, not being used within the ED department. But I know that we only have 2 vials of muscle relaxants in the whole hospital. That's it. So surgeries, ED, everything. We only have 2 vials of muscle relaxants left, which as part of the way that you intubate someone is you've got to paralyze them in order to be able to
Right.
intubate them. And we only have 2 of them. And obviously there are hundreds of people that need surgery. So we are already struggling. And if we have another mass casualty event, I don't think we're gonna survive.
Um, have you gotten any surgeons in yet? At one point you were needing surgeons.
We do need surgeons. Unfortunately, the system to get in has to go through COGAT, which is the coordination team with the Israeli government, and they decide on who gets in and who's allowed in and when you're allowed out of Gaza. And unfortunately, when medical teams apply, we get approval from the UN and the World Health Organization, but the Israeli, the COGAT, have the final say, and they don't usually tell you till about 5 hours before departure whether you're allowed to enter into Gaza or not. So we've had doctors that fly in from Ireland, from America, from Australia, who've all flown in only to be told 4 hours, 5 hours before departure that they're not allowed to enter Gaza. And it seems like an overwhelming majority of those that are not allowed in are surgeons.
They're not letting in the surgeons. Okay.
Yeah.
Is there any kind of explanation for that, or they're just letting in?
There is. I mean, there's no explanation for that. There's no explanation of why we don't let in food for 1 million children. There's no explanation of why we don't let in medical equipment, especially pediatric children's medical equipment and children drugs. We need medical supplies in. We need doctors here, we need surgeons here, and we need the bombing to stop because we don't have the capacity. We have patients from 2 days ago still in tents outside of the hospital, and these are patients with major trauma injuries, people with facial burns, people with limbs partially missing, people with head trauma and intracranial bleeds, and all of these are just in tents. There isn't enough doctors. So there's one doctor maybe looking after 5 or 6 tents. Each one of these tents might have 30, 40 patients. And these are critically unwell patients. If they were anywhere else in the world, they would probably have, 4 or 5 doctors seeing them for an hour each individually. But we have one doctor seeing maybe 40 to 60 patients. It's not safe. We don't have the necessary medicines or the necessary medical equipment to treat them. And the number of dead will rise over the next coming days because a lot of those people with those injuries are going to die.
Do you know what the number is right now? We heard at the very first day that it was like 400 overnight.
I'm being told now by my colleagues that there has been around 1,000 people killed in the last 2 years. That's the most intense and highest number of killed civilians since the first months of this war. Right. So it is really, really intense. And obviously, if this continues, we're not going to cope. So we are really, really struggling at the minute.
Have you seen any signs of Hamas? Have you seen any reason why they're targeting this particular area?
I mean, look, we've not seen. I mean, we're just doctors working in the hospital. We don't really see any of Hamas. We don't see any of even the United Nations workers as well. We don't see them either. They're based outside. We only see them when they come here. Gotcha. Mainly what we're treating is, I'm mainly based in the emergency department, and mainly what we're seeing is women and children that are being brought in and that are injured.
Okay. Just trying to establish, like, if there's some, if there, I know at one point there was military justification.
I understand, and it's obviously a very touchy subject for everybody to ask because of these hospitals that have been destroyed because of that justification.
Right.
But I've been here now on my second medical mission. Mm-hmm. The hospitals are full of women and children and doctors and nurses. The hospitals are overwhelmed with injured bodies everywhere. Injured women. It is a place where there are multiple international aid workers, United Nations workers that are here. It's pretty hard to hide a military in here with all of these foreign delegates in here as well. And we have full access to the hospital. We're allowed to walk around the hospital, go into every building, every room. No one restricts us from going anywhere. So it's almost like a bit of a, it's something that I have not seen any justification for in my experiences here since being in Gaza.
Heard. Did you have a set time that you were supposed to be there, like a set,
yeah, so I'm supposed to be here,
I guess.
Yeah, I'm supposed to be here for about 4 weeks. Probably now with the borders closed and no doctors are allowed to leave at the minute, we obviously don't know what's going to happen. So yeah, at the minute we're just here. We'll wait and see how things go, and we're just going to have to hope for the best. But nowhere is safe. And obviously, everyone's worried about their safety. Everyone's worried about the patients. And, we're also worried about the hostages as well. They're
Yeah.
carpet everywhere, worried about them as well, worried that they might not survive this either.
Right.
We're worried for everybody here.
So when was the last bombing? You say it's continuing around the clock?
Literally right now, I can literally hear the bombs going off in the background right now.
Ah, okay.
Right now, it's non-stop. It hasn't really stopped. I've been working throughout most of the night, went up, took a couple of hours sleep, went back to the emergency department. I've come up now just to quickly do the interview, and
Right.
I'm going to go back to the emergency department. So, we're
Understood.
non-casualties, unfortunately.
Any message that you want to get out that I, have not asked about?
I just want people to understand that, blocking off humanitarian aid, food and water to 1 million children is a war crime. And we are feeling the effects of that war crime here in the hospitals. We need medical equipment here. We need medicine here. We need food and we need water here. Otherwise, many more people are going to die, and many more people are going to die that don't need to die. And I'm worried for their safety.
Okay, Doctor, I will let you get back. Thank you very much for your time. Godspeed. Good luck out there. Stay safe.
Yeah, thank you for having me.
You bet.